Hello, this is the American Medical Association's COVID-19 update. Today, we're discussing the results of an AMA survey on the financial impact of COVID-19 on physician practices and what this may mean to practices as we head into the winter. I'm joined today by Carol Kane, the AMA's Director of Economic and Health Policy Research in Chicago, and Dr. Christopher Garofalo, Family Medicine Practice Owner in North Attleboro, Massachusetts. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Carol, can you begin by telling us why the AMA conducted this survey?
Absolutely, Todd. I'd be happy to. I guess we just wanted to better understand how physicians had been affected by the COVID-19 pandemic and how they were dealing with the many challenges they have faced since its start. We recognize that there had already been a number of physician surveys that were conducted, but we still felt that there was a significant gap in information between what we knew and what we needed to know. And we really wanted to go out there and get more precise information on how patient access had been affected in terms of patient visits, practice revenue, issues with PPE. And there was, we really needed that information to really tailor our advocacy for the right kind of policy in order to help physicians and the practice in medicine and allow patients to retain access to care. Very important.
Dr.
I was actually
Garofalo, yeah, go ahead.
I was actually one of those physicians who actually answered that survey, and I remember seeing it and thinking how appreciative I was, especially as a private practice owner in Massachusetts here, uh, that AMA was taking an interest in this very appropriately, and it was a very very enlightening to see that this was such a great topic for you to be covering. So thank you.
Can you speak to that a little more personally, Dr. Garofalo, in terms of the impact that COVID has been having on your practice?
Yeah, I think the first thing that we noticed was a decrease in visits, and it really dropped off a cliff, so to speak. I mean, it went from, 100% capacity to 25% capacity. And some of that was simply patients who just didn't want to come in. And some of that was that, the state had said, you need to curtail this. So we saw decreases in visits, which made it difficult for us, obviously, to treat our patients in the way that we needed to. We also saw decreased visits because we were sending people more over to urgent care to get tested for things like COVID, which we had initially had chosen not to do.
Carol, can you talk a little bit about the survey? We're hearing from one person on the other end of that survey. How many other physicians were surveyed, and do you think that you were able to kind of capture the experience of the physicians at large with this?
Yeah. Well, first, it's so gratifying to hear from one of our survey members, and how important you thought it was. In addition to you, we also surveyed 3,499 other physicians for a total of 3,500. And when we started the survey, we really wanted to make sure we had really accurate, defensible data with which to support our advocacy with. So we worked with a trusted partner, a panel company that we had worked with many times before, to really make sure that those 3,500 physicians mirrored the physician population very closely in terms of age and gender and specialty and the parts of the country in which they worked. And we got very close on all of those basis points. So we do feel very confident about our survey results and that they reflect what physicians were going through and what their practices were going through over the summer, from the period of mid-July to the end of August. Physicians they took about 40 questions were in the survey, and there were a couple of qualifications that physicians had to meet to get into the survey. Most importantly, they had to be providing at least 20 hours of patient care back in February prior to the pandemic to make sure that we were targeting, actively practicing physicians. And they had to be in one of the 50 states or DC and have completed their residency programs.
All right, well, let's talk about the findings. What are the key learnings coming out of the survey?
Well, there are a lot of findings that are both interesting and alarming. I guess the one that jumps out as one of the top level findings is that even more than 4 months after the survey, more than 80% of physicians said that their practice revenue was still down from February, and I'm sure that resonates with Dr. Garofalo. And the average decrease in practice revenue, again from February to the summertime, was over 30%. I mean, that is huge. And when you combine that with the PPE challenges that physicians have been facing, both in terms of cost and access to them, it just really illustrates the financial strain that practices have been under, and
So it's
that
really
they're continuing.
happening on both ends. So you're talking about, revenue decrease and higher expenses on the same side for PPE and the like. That's the
Absolutely.
Yeah,
so. Go ahead.
I would echo that. I think we have seen that on our side as well. We saw significant decreases in revenue, again, especially at the start. Once we were able to get telemedicine, which I know we'll touch on in a bit, up and running, that really improved. And we actually, at this point for the past month, we're probably about 80 to 90% of what we were. So we're sort of, right around where everybody else is. We did see an increase in our PPE, and it was difficult to get. And the part of the stuff that we could get was more expensive. That was one reason that we sort of decided not to do testing in our office, which was really difficult for us to make that decision. But it was just really hard to sort of have that level of PPE in our office and to be able to afford that at the time.
Carol, I'd like to talk a little bit more in depth about PPE. It continues to be a problem. Can you give us an idea of just how much more spending physicians were seeing and what their situation is right now?
Absolutely, Todd. We found that over the summer, at least a quarter of physicians said that their PPE spending was at least 75% higher than it had been in February. And the average increase in PPE spending was 57%. So, very, very large increases. And in addition to the cost, even 4 months after the start of the pandemic, physicians were still telling us that they were having difficulty getting PPE. Over a third of physicians said that getting adequate PPE for their practices was very or extremely difficult. And this seemed to be particularly acute for practices that were smaller or that were physician owned, just because they don't have the purchasing power that these larger practices or practices that are part of health systems can rely on.
Does that continue to resonate with you, Dr. Garofalo?
It does. We have 8 physicians, an NP, and a PA in our practice. So we're sort of a moderate sized practice. But yes, it is very difficult to get that. We actually dipped into our state. Fortunately, Massachusetts had a program to get some PPE when we could not get it from our usual suppliers. So that was actually very helpful. And I think, the state, I know the AMA, AAFP, a variety of groups have all stepped in to help. One of the issues with PPE, I think, is sort of how you define, what is appropriate PPE. Prior to this pandemic, nobody would have thought of using an N95 mask more than once. It's not meant for that. I think that a lot of us have just gotten used to a sort of a new normal where, nurses and physicians will use a PPE, an N95 mask for a day, a week. So even if places are getting enough PPE, I'm not necessarily convinced that that's necessarily as safe as what it would have been pre-pandemic.
Mhm. Well, Dr. Garofalo, you mentioned before about telehealth, and I'm curious to find out about the use of telehealth and expansion in your own practice. How has that been affecting you?
It has been a lifesaver, a practice saver. Um, we had actually started looking into telehealth prior to the pandemic. My practice was actually one of the practices in Massachusetts that was part of the telehealth initiative with the AMA, Texas, and Florida Medical Association. So we had actually started looking into that. And just as we were starting to look at vendors, bam, along comes COVID. And so we didn't, we really had to step it up. And it was nice in my practice because I had been looking at vendors already. So we were able to choose a vendor fairly quickly, get up and running. I trialed it for about a week in my practice. I went back to the rest of the group and I said, we have got to do this. And I said, here's how you do it. And we quickly got everybody on board. So patients were pretty enamored with it. They liked it. They also realized that even if this wasn't the best way to do a visit, that we needed to do it at that time.
Mm. Did you find it, in terms of offsetting losses from your in office visits? How did that, net out in the end?
That netted out very well. One of the things in Massachusetts, and I think in some other parts of the country, our governor actually said that insurance companies were mandated to pay at parity. So an office visit that would have happened in the office would now pay the same as doing it on telehealth. And that was actually really important. And I know that we are extremely fortunate in Massachusetts. I know there's a lot of practices. I've talked to colleagues around the country for whom that was not done in their state. And I know they are probably having a lot more trouble than we are. So I think that's one thing that's really important that the AMA can advocate for, as well as at your state society. Um, we brought our revenue. It took a couple of months, but we got ourselves up 50%, 75%, and now we're sort of like at that 80, 85% mark.
Well, Carol, is the survey, did the results kind of bear out what Dr. Garofalo is saying? What are you seeing from that on telehealth?
Well, I think that Dr. Garofalo's practice, because of its location in Massachusetts, is really on the favorable end. I mean, not all. What we found, I think, would reflect what you were saying, that not all practices have been as lucky to have that parity in payment. But even on top of that, we found that even when you account for the increase in telehealth visits, and I can get into some of the details, that for the average physician, the increase in telehealth visits did not make up for the loss in in-person visits. And just to give you some examples of the change over this period, which was marked, we went from only 20% of physicians using telehealth on a weekly basis in February to 77% using it on a weekly basis at what we call the height of telehealth, which for most physicians was in April, to 68% over the summer. So, still much higher than it had been in February, very much so. And the average number of telehealth visits went from 6 per week in February to 29 per week over the summer, to 29 per week in April, the height of use, to around 16 over the summer. So, we're still up 3 times what we were in February, but that just wasn't enough to make up for the in-person loss. And in fact, over the summer, around 70% of physicians were telling us that their total patient visits, including in-person and telehealth, were still below what they had been. And a little bit different than your experience, I would say. And that for the average physician who was providing about 100 visits per week in February, it was down to just above 70 per week over the summer, including both types of visits.
So we did see telehealth help practices in seeing
Yes,
patients, but we haven't seen it increase, patient volume to pre-pandemic levels.
exactly.
All right. Well, what needs to be done to help practices through what continues to be a difficult time and one that might just get worse as we head into the winter? Dr. Garofalo, do you want to start?
I think that getting telehealth visits to be paid at parity is one of the most important things. And I realize that not everybody may end up utilizing telehealth in that way, or up to 100% of that level. But I think making sure that we have the ability to do that, I think telling our patients that this is a safe way to do visits if we need to, um, is an incentive for the patient to do it and also for the physician to do it. It keeps our waiting rooms less full. It means patients don't have to go out quite as much. So I think payment parity is one of the bigger ones. I also think that making sure that physicians have access to PPE. Again, one of the things that we found is if we can't see patients who have fevers, have chills, who have symptoms of COVID in our office, we end up sending them to urgent care. There's great urgent cares around us. We're not worried about that, but that definitely takes patient visits and revenue away from our practice, and again has an effect on that. So making sure that we have enough PPE so that we can offer that service if we choose to do so.
Carol, can you tell us what do you think needs to be done to help physician practices right now?
Sure. Well, I think they definitely need help, getting adequate PPE for their practices, for starters. And the AMA has been involved in that through partnering with an organization called Project N95, through which our physician members can gain access to the PPE that they need, and making sure that that PPE is, of quality and certified. And that partnership will continue through the fall, as we have seen COVID-19 cases, start to spike again. Our advocacy group has also worked to secure a number of types of federal financial assistance for physician practices, and examples of that include the CARES Act, the Small Business Association Paycheck Protection Program, the Medicare Medicare Accelerated and Advanced Payment Program. And when we actually talked to physicians during the survey about those programs, for physicians who had applied and then received that federal aid, they did say that it was, very or extremely useful for their practice. But of course, it's, as the survey illustrates, it's we're not done. It's simply not enough. And the AMA is continuing in this vein to try to get additional funding for the Paycheck Protection Program, for the HHS Public Health Emergency Fund as well, and to try to extend relief from the Medicare sequester and Medicare payment cuts that had been planned, which would be kind of the worst combination of things. We also, working with our specialty societies and the RVS Update Committee, we were able to develop a code which was then approved by the CPT editorial panel, and physicians will be able to use that code to try to get payment for the additional supply costs, through the acquisition in PPE and other things, that they're all going through in order to, keep their staff and their patients safe in the practice.
Well, that's
Um, yeah.
Just to follow up on one thing you said, the collaboration with Project N95 that the AMA did earlier this year will be repeated. Look for information for that coming soon so that you can reserve more high quality PPE. I want to thank Dr. Garofalo and Carol Kane for being here today, sharing their perspectives, and for all of the hard work to make physicians sure that physicians have what they need as we enter this summer or this winter period. That's it for today's COVID-19 update. We'll be back with another segment soon. For resources on COVID-19, visit ama-assn.org/COVID-19. Thanks for joining us, and please take care.